Hello there. Welcome to another episode of the Health Tech News brought to you by Medics in Tech. My name is Glory and I'm super excited to welcome you to another episode. Today, I have interesting updates for you as usual. So, without wasting time, let's get right into it. Welcome back. First on the news today is an interesting update from Kenya. Kenya launches East Africa's first AI-enabled scanner at the Nairobi hospital. Did you hear that? The first AI-enabled scanner. That is what makes this news exciting. All right, let's get to know more about what this scanner does and other updates about this news. This AI-enabled scanner delivers a high-speed, low-dose and ultra-precise imaging, enabling more accurate diagnosis across a wide range of specialties, including oncology, pediatrics, cardiology, neurology, and trauma care. Of course, there were comments during the launch of the scanner. Let's get to them. Speaking during the launch, CS Duale aimed the development as a significant milestone in diagnostic medicine in Africa. According to him, this is more than a technological upgrade. It's a clear signal of our national commitment to innovation and equitable healthcare. It underscores our determination to ensure every Kenyan has access to timely, accurate diagnosis and better health outcomes. Now, in addition to the launch of this AI scanner, something strategic happened during the event. The Ministry of Health in Kenya signed a strategic collaboration framework with the Nairobi Hospital through the Social Health Authority, SHA. This partnership will focus on expanding access to specialized care for underprivileged patients, especially those battling cancer and kidney diseases. Through these initiatives, eligible patients will receive comprehensive oncology services, critical renal care, including free hemodialysis and subsidized kidney transplants, with full support from pre-surgery to recovery. Now, this is really impactful, especially because underprivileged patients can have access to healthcare services at little or no cost. Now, CS Duale also made a comment about this. He emphasized that this collaboration is rooted in equity and access. According to him, this partnership reflects our belief that quality healthcare is a right and not a privilege. Together with SHA and the Nairobi Hospital, we are ensuring that no Kenyan is left behind due to financial hardship. And that is really thoughtful of the Kenya government, and I'm going to give it to them. So you would agree with me that this innovation has placed Kenya and the Nairobi Hospital at the forefront of medical innovation on the continent. So kudos to Kenya, and I'm looking forward to more of these innovations. Now, let's go to another interesting update, all the way from Senegal. Next on the news, Kera Health leads Senegal's digital health revolution with IFC Banking. Kera Health is a digital health platform developed by a Senegalese startup. It was launched in 2022 by Mustafa Kizé, Papa Sow, and Osam Matar. So what exactly does this Kera Health do? Before we move on to how they are leading this digital health revolution in Senegal. Kera Health leverages artificial intelligence to connect key stakeholders across Senegal's healthcare ecosystem. Since 2023, the startup has been supported by the International Finance Corporation, IFC. Did you hear that? They have been supported by IFC since 2023. Now, something interesting happened in 2025. In June 2025, Kera Health announced a successful $10 million funding round aimed at strengthening its digital infrastructure, expanding services to additional cities across Senegal, and laying the groundwork for regional expansion. Well, I really believe that this funding will really make such impact. So now you know why the news headline says that Kera is leading digital health innovation revolution in Senegal. So what else does Kera Health do? Kera Health securely centralizes critical health data, including medical records, lab results, prescriptions, and insurance information into a unified interface accessible to authorized healthcare providers. The platform also uses AI algorithms to identify health trends, automate routine monitoring, and support clinical decision making. So getting this funding is really going to help them expand their work. And I'm looking forward to all the amazing things they will do in the years to come. All right, that's it for Kera Health in Senegal. Let's move on to the next news update. Next on the news, let's take an update from the recent African Health Summit that held in Lagos State, Nigeria. At the Africa Digital Health Summit, the federal government of Nigeria unveiled their bold agenda for digital health in the country. I believe by now you're curious about what this bold agenda is all about. Well, let's get into it. The federal government has reiterated its commitment to revolutionizing healthcare delivery through digital innovation, artificial intelligence, and data systems at the 5th Africa Digital Health Summit, ADHS 2025 in Lagos. The Africa Digital Health Summit is a 2-day event held in Lagos with a theme, strengthening health system through digital innovation, data, and AI. That's quite an interesting topic, if you should ask me. Well, let's get to know more about what this booster is about. This African Digital Health Summit brought together policymakers, innovators, academics, development partners, and of course, investors under one roof. Now to the main gist of this news update. Speaking at the event, Honorable Minister of State for Health and Social Welfare in Nigeria, Dr. Isiaq Adekunle Salako, described digital health as a critical enabler in the ongoing effort to reform Nigeria's health sector. The summit, Dr. Salako announced that the Nigeria Digital in Health Initiative, NDHI, has been launched to drive President Bola Ahmed Tinubu's vision of ensuring every Nigerian accesses healthcare wherever they are without financial hardship. According to him, this initiative will create millions of jobs by leveraging the ingenuity of Nigerian youth while setting standards and ensuring interoperability of digital solutions. The minister also emphasized that private sector remains the backbone of this transformation, calling on innovators and investors to deepen their commitment as the government creates a conducive policy and investment climate. And in conclusion, Dr. Salako also acknowledged the collaborative roles of supranational governments and commissioners of health, urging states to align with federal efforts to ensure scalability and national impact. I believe now the bold agenda of the federal government is clear. The federal government of Nigeria is intentional about digital health innovations, and we can see that from the recent happenings in Lagos State Healthcare. So with this, I'm looking forward to all the plans unveiling, because the most important thing is seeing that the plans they have is actually being implemented. So let's keep our eyes on the lookout. All right, let's go to the last for today's news updates. Now, this particular update is quite a bonus, but of course, interesting one. So let's get right into it. Next on the news, Novartis receives approval for the first malaria medicine for newborn babies and young infants. On the 8th of July 2025, Novartis announced that Coartem Artemether Lumefantrine Baby has been approved by Swissmedic as the first malaria medicines for newborns and young infants. Did you hear that again? The first malaria medicine for newborn. This has been long awaited, and that is why this is especially exciting, right? I don't know if you agree with me, but that's how I feel. All right, let's go to more of this update. This new treatment, also known as Environment Baby in some countries, was developed in collaboration with Medicines for Malaria Venture to treat the potentially deadly mosquito-borne disease. Now, 8 African countries also participated in the assessment of this new drug and are now expected to issue rapid approvals under the Swiss agency's marketing authorization for global health products procedure. There's something more interesting about this update. Novartis plans to introduce this infant-friendly treatment on a largely not-for-profit basis to increase access in areas where malaria is endemic. Did you hear that? Not for profit. This is really impactful, and I love innovations that are really impactful and are looking at areas where people cannot afford healthcare services. So I give it to them. This is a job well done. Now let's take some comments about the approval of this drug from some important personalities. The first is the CEO of Novartis. According to the CEO, for more than 3 decades, we have stayed the course in the fight against malaria, working relentlessly to deliver scientific breakthroughs where they are needed most. Together with our partners, we are proud to have gone further to develop the first clinically proven malaria treatment for newborns and young babies, ensuring even the smallest and most vulnerable can finally receive the care they deserve. That comment was really inspiring. Now, let me give you more juicy details. Until now, there has been no approved malaria drug for infants weighing less than 4.5 kg. And of course, this leaves a treatment gap. And another critical part is the fact that malaria vaccines are not even approved for the youngest babies. So, more reason why innovation like this, development of a drug that can address this gap in treatment, should be celebrated. So, kudos to Novartis again and again and again. Now, let's take a last comment, and this comment will be coming from Martin Fichert, the CEO of Medicines for Malaria Venture. According to him, malaria is one of the world's deadliest diseases, particularly among children. But with the right resources and focus, it can be eliminated. The approval of Coartem Baby provides a necessary medicine with an optimized dose to treat an otherwise neglected group of patients and offers a valuable addition to the anti-malaria toolbox. So everything she said is true. And I'm super excited again for this innovation and the fact that there are now treatments for babies in terms of malaria. So would be able to reduce the rates at which children are lost to malaria. So again and again and again, kudos to Novartis. And that's it on the news today. I hope that these updates were impactful and you've been able to catch up on the updates happening in the world of health tech. This is Medics in Tech, your go-to platform for everything related to digital health in the world. So do you want to catch up on news updates? You want to learn courses or gain skills in the digital health industry? This is your go-to channel. So ensure that you subscribe so you don't miss out on any of our updates. Also, scroll through this channel to get access to all the resources we have made available for you. Also, if you're on LinkedIn, give us a follow because we have opportunities available to scale you up in this digital health industry. Thank you for listening to this episode. I'll see you in the next news updates. Bye.